Here with Josh and Paul, of course, and Melissa McCall and Chris Murphy. As you probably know, the American Rescue Act passed $1.9 trillion. Really thanks to Dick Blumenthal, our amazing congressional delegation, and special thanks to Senator Chris Murphy, who works hard to make sure that our state municipalities and superintendents had the flexibility and time to make sure this money was really well spent. And I'm going to ask him just to say a few things, in particular his focus on kids and folks with disabilities. And Melissa, as you know, runs the Office of Policy and Management. You'll have some questions for her, I'm sure, about when do we get the money, how do we access the money, and you won't be totally satisfied with the answer because we're still waiting for guidance from Treasury, but we'll do the best that we can. That said, let me just give you an abbreviated version of our COVID summary. I think basically the good news, this numbers go back to Friday, is top positivity rate continues to stay low. The hospitalizations goes down, so it's the lowest we've had in months. You know, that was key for us. And fatalities, that's 21. That's over 3 days. Thank God that number is trending down as well. Don't lift your guard. I mean, it's worth remembering that the variant used to be known as the UK variant has gone from about in the 40s to 81, in the last week. So we watch that carefully, but it's worth knowing it's not going up exponentially. It's going up more linear, but it's still something that we pay special attention to. And very, very low incidence of the South African variant. So we think we have a good handle on where we are, at least right now, in terms of the infections. And part of the thanks goes to the vaccine program, which is rolling out pretty successfully. Really special thanks to all of our partners on this, federally qualified health centers, the healthcare providers, really making an extra effort to get to the underserved populations. As you can see, we've got about 75% of the 75 and aboves. That's where the bulk of the complications are. Almost 65% of the 65 and above, little parallel there. 25% of the 55 to 64, and we're going to ramp that up. So it's over half of those over 55 have received their first shot of the vaccine. We'll have an overwhelming majority of those 55 and above will have their first shot by March 19th, which, as you remember from last week, is the day we continue to cautiously reopen. 137,000 doses are scheduled for delivery, already arriving right now. So for those of you who said, oh my God, my appointment is put off for 3-4 weeks, what do I do? Remember, there's 137 new appointments that are being made available this week, so feel free to check in. If you get a better appointment date, please cancel the later one. And about 11,000 doses of J&J have been administered to date. American Rescue Plan, you've heard a lot about it, $1.9 trillion. I think it meets the moment. I've heard all the complaints. My God, how come it's for more than a mask and ventilation? And why isn't it just specific to COVID health care? And why does it go on beyond December 31? I think because the long-term effects of COVID are going to go on way beyond December 31. I know what that means for our kids. I know what that means in terms of our economy. I know what that means in small business. I know what that means in terms of stabilizing our municipal and state budget going forward. So I, for one, am very thankful that you're going to see $2.6 billion in state relief, give or take, and $1.6 billion in for towns and municipalities, local relief. And that money is supposed to be allocated through the end of 2024. So there's a few years here. So we're working hard to balance that out, make sure that the monies are invested in the most significant way where we can make an enormous difference. I'm sorry for those that say, hey, great, let's use all this money to reduce taxes. I take it that is not allowed. This is supposed to be incremental, and nor can you just pour it in the pay off old pensions. This is money that's going to be invested to make a difference for people. And let me give you a couple of examples on the next slide. So the American Rescue Plan, school support, learning, development, catch-up. Here, Chris is going to talk. Let me just say a couple of things. We've had more of our schools open than just about anybody else. Most of our schools, almost all of them, for in-person learning going back to September. But we still have a couple 100,000 kids that didn't feel comfortable going back to school. And they've been out of school for close to a year now. So what we do with this education funding is significant. It starts the day after school ends in June. And we're going to talk very specifically about the ways we get these kids back engaged. And it's, STEM and learning and 3 R's and book and classroom and lost learning is really important, but also getting these kids socialized and back with their peers. And some of the incredibly innovative programs we'll be able to afford, working with our camps, working with the not-for-profits, working with business for internships, ways that these kids can get back together, socializing with their peers and learning. The enhanced unemployment insurance benefits, that was about to end, I think, on the 14th or something. That will be extended another 6 months. I think it's a $300 plus up. You know, we're working hard. Our old creaky computer system over at Department of Labor has had to do some, sprightly moving, but I think we're going to be very close to be able to get that adjudicated on time, so you'll see those monies relatively soon. Most quickest you'll probably get are the direct stimulus checks, hopefully within the next 2 or 3 weeks. That is money that comes directly from the federal government. That's $1,400 for folks earning up to about $75,000 a year. More for a couple, more if you have kids. I'm very pleased with the child credit. I think that's really important. That's $3,600 a year per kid you have under the age of 6. Doing everything we can to make it easier for you to raise a family and make that affordable. It's super important now. We have, you heard me say it probably too many times, we have fewer women, a lower participation factor in the workforce today than any time in the last 30 years. Women have been particularly hard hit by this pandemic, the first to lose their jobs, slower to get back, often enormous child care costs and other issues. This is the International Women's Day, I'm told. So I'm really pleased that the emphasis that the American Rescue Plan placed upon child care and daycare. We're going to have Beth Bai on very soon to say what we can do to expand the base of daycare, make that widely available, universally affordable, for as long as we can do that, to give you the confidence that your kid is in good hands and that you can get back to work. A couple of other things, energy assistance and rental assistance, again, knowing that that doesn't end in the next 90 days, that we're going to have a glide path to allow you to pay those utility bills and to pay, rent and mortgage. And there's some real support there as well. And finally, mental and behavioral health. And, with that, I'm going to pass it over to Chris Murphy. But people know in no uncertain terms what this has meant in terms of stress, what this has meant in terms of trauma. We see that reflected in our 211 hotline. We see that reflection in domestic violence and addiction, and we hear that all the time in terms of our kids getting back in the game. And nobody's been more of a leader in doing what he can to help our kids than Chris Murphy. So, Chris, thank you for the great work you and Dick and the entire delegation did, and appreciate your work on behalf of the kids.
Thank you very much, Governor. Thanks for inviting me to say a few words today on behalf of the delegation. But first, just let me quickly return the compliment. Obviously, we have been very proud to be able to tell Connecticut's story over the course of this pandemic. Early on, Connecticut was a hotspot through no fault of our own, and we turned the corner over the course of the spring and summer faster than any other state because of your leadership and the fact that we have a can-do attitude in our state, people willing to step up in the education sector, the healthcare sector, small business sector. And now we can tell the same story of success when it comes to vaccination rollouts. I was down in Hamden today at Cornell Hill Scott Health Center's clinic, and they are getting those vaccines out as quickly as humanly possible. Every clinic I go to is so proud to tell me that, over the course of the first 2 months, they've, only wasted one shot, only lost 2 shots. I mean, it is absolutely exceptional how efficient our operation is. And I think Connecticut is going to meet those national targets faster than anybody. But I want to thank you for allowing me to come on and say a few words today and perhaps help answer any questions about the American Rescue Plan. You're right, this was a team effort. President Biden proposed this package. We made amendments in the Senate and the House, but by and large, this is the plan that the president ran on. This was the mandate that he was given. President Biden said that he was going to run the White House in a way that unified rather than divided the country. And a lot of people were skeptical of whether he could do that. It's pretty stunning, the public reaction to this rescue plan, especially in the wake of the partisan nature of the transition. 70% of Americans, including 60% of Republicans, support what's in the American Rescue Plan. This is a package that has unified the country because, of course, this virus doesn't discriminate. And there is need in every sector of the country, regardless of what your politics are. You, I think, did a good job of summarizing what's in this bill. But let me just talk a little bit about this from a very sort of personal standpoint. I started the day in New Haven. New Haven is a hardworking community, but it has a lot of folks, that are, working for barely over minimum wage. Well, if you're working, at or around minimum wage, and you've got a couple kids, the provisions of the American Rescue Plan are going to increase your take-home income over the course of the next year by about a third. And why we built the American Rescue Plan by building up from the bottom of the American economy, right? Putting money into the middle class and into poor families' pocketbooks is because we know that that money is then going to be spent in the Main Street economy. We know that those people are going to take that money and go out and spend it in small businesses and restaurants and retailers all around the state. We think this is a plan to power this economy to close to full employment. But as you mentioned, Governor, we also built this so that it will hopefully be the last relief package that Congress needs to undertake. This is, I think, the 5th relief package that Congress has passed. This is going to be passed by the House tomorrow, as I understand it, signed by the President later this week. But we want it to be the last one so that we can move on to other very important issues. And that's why, we do recognize that the effects of COVID-19, the effects of this economic crisis are going to last beyond 2021. And so we do provide for an allowance so that these dollars, whether they're the money that go to the states, $2.6 billion coming to Connecticut, the money going to cities, $676 million under this package, or the money going directly to schools, somewhere in the neighborhood of $1 billion for Connecticut schools. We want to make sure that those monies are able to be used to deal with all of the aftershocks that come from COVID-19. That means we want to be able to stretch out support to our schools because the catch-up for learning loss is going to take a long time. We want to be able to stretch out support to small businesses so that we can give those businesses an on-ramp back to sustainability. And we want to make sure that the state has the ability to deal with the fact that there will be revenue loss that will last for years because of this unprecedented crisis. Lastly, Governor, you mentioned the role that I've played in the education title in this bill, and so I'll end by talking about some of the work that I and others helped lead to try to dot the I's and cross the T's when it came to the record education investment that we made through the American Rescue Plan. In particular, I wanted to make sure that we were spending money on special education students with high learning needs and on summer programming. Governor and I have talked a lot about the need to use this summer as an ability for kids to restart. Yes, some kids are going to need to spend some of the summer catching up with learning loss, but a lot of other kids are going to need to just have a really psychologically and emotionally healthy experience this summer. We're going to need to make sure that all of those kids that have been chronically absent, the kids who haven't signed on to online learning, who haven't shown up to in-person learning, that we get them into summer programs so that we can assess their emotional and educational well-being, so that we can reset them for the upcoming school year when we hope that things will be back to normal. And so I'm excited to work with the governor and others to make sure that we, expand out the number of affordable summer programming slots for kids in Connecticut. Excited to take these education dollars and make sure that we wrap services around the neediest kids in Connecticut. We have a lot of them, and they're going to need a lot of help, especially when schools reconvene in the fall. So I sit on the Education Committee and the Appropriations Committee, so glad to play a role there and look forward to working with the governor and his team on making sure those dollars land on the ground in a way that helps the kids who need the help the most. Thanks to my colleague, Dick Blumenthal, we work as a team. Obviously, we're blessed to have the chairwoman of the Appropriations Committee representing Connecticut. The child care tax credit has been Rosa DeLauro's project for 20 years. She has been the leading proponent of expanding that. This bill, by expanding the child tax credit, will reduce child poverty in this country by 50%. That is a just extraordinary result of the American Rescue Plan. So, Governor, thanks for having me on, and thanks for being willing to keep in very close touch as we've worked on this plan and negotiated it through to near completion.
All right. Thank you, Chris. Chris is sticking around a little bit longer. Like I said, of course, Paul and Josh is here, and Melissa McCaw can do our best to answer questions right now in terms of the practicality of how this money is going to start to move.
Channel 3 Eyewitness News.
Good afternoon, everyone. Based on the new CDC guidelines for fully vaccinated people being able to gather indoors with no mask on, do you think that's going to change any restrictions here in Connecticut?
Not for the near term. The CDC guidance said, look, if you're hanging around with a lot of other people who have also been vaccinated, then you don't necessarily have to wear a mask if you're in a private setting, which is sort of good common sense, I think. More broadly, though, it's going to still take a month or two before the broad cross-section of people who have been vaccinated. In the meantime, it's a good thing to wear your mask and show respect for them, even if you have been vaccinated.
Thank you. And one last question. Is there a ticking clock for teachers and child care providers who want to get the vaccine, but they have not been informed by their health district, when they'll be able to, when those specific slots are for them? And, will they be grouped in with everyone else?
No, there are still folks who work in our schools are an absolute priority. 25 to 30% have already been vaccinated. If you haven't not yet heard from your superintendent or your principal or local public health department, you will.
And Governor, I just add, because we know there's thousands of child care providers out there, and there may be some who are still trying to figure out how they get connected in. On the website of the State Office of Early Childhood, Commissioner Bai has a list posted there for every single town, if you're a child care provider, how you get connected into a vaccination clinic in your community.
Thank you.
News 8.
Good afternoon. For Senator Murphy, when you talk about the American relief, Senator, there's a lot to it, obviously, and a lot of people that can be helped by this. Can you sort of prioritize, and also with respect to the children and even stuff like summer camps, how much of that is directed? So much has been discussed about the mental health of the kids away from their friends and remote learning. How much would go into trying to help with mental health and stuff like that?
Sure. So there's a number of ways to answer that. Listen, this is a substantial amount of money for America's school system, $130 billion overall. And the reason that we have made this historic investment in Connecticut schools and in schools across the country is because we know that kids have been hurt by this crisis. I'm a parent of two school-age kids, and they have all of the supports around them that they need to succeed. And I can just see how difficult it's been for them to keep up and how emotionally drained they are by being away from their peers, by having all of this uncertainty surrounding their lives. So what this money really is dedicated to is building support services, likely in many cases temporary support services to last a year or two around these kids to make sure that they have the sort of social work and emotional supports necessary, and that they have extra educational help around them to try to make up for that learning loss. We have given pretty substantial flexibility to states in terms of how to use this money. As I mentioned, there's a small portion of the money that must be spent on summer programming, and that is allowable not just for summer school, but for summer camps as well. There's a small portion of the money that needs to be spent on special education students, on students with IEPs. But broadly, schools are going to be able to fit these dollars to their particular needs. I think did a better job than most states in getting our kids back into school. But as we know, especially in Connecticut cities, there's a whole group of kids that have not connected back with their home school, and they're going to need some of those extra dollars, perhaps some paraprofessional support around them over the course of the spring, summer, and fall. So listen, I'm excited for what we're going to be able to do to help make up for all of this learning loss for kids, but I'm also equally excited about the work that we're going to be able to do to try to make up for the emotional trauma. There's additional money in this bill for mental health programming. So community health centers get $6 billion under the American Rescue Plan, and there's another $3 billion dedicated to increase mental health programming for all citizens, young and old. So you're also going to see Connecticut's health centers and Connecticut's mental health centers get a major infusion of funding over the course of this year that will allow them to hire more staff and reach more people that have been in mental health crisis over the course of the last year.
Thank you, Senator. And Governor, many months ago, I asked you about the balancing act that this has been for you, not specifically to comment about the situation over the weekend at UConn, but when you put all the factors together in the metrics, trying to help the economy, and so on and so forth, how much do you have to consider that particularly young people being at the end of their rope in terms of dealing with this, and then could act upon that similar to what happened this weekend? How much do you have to consider how much time has gone by and where people are at and about letting their guard down?
It's at the start of my consciousness every day. I got to tell you, I lose sleep when I think about these schools. They were closed for a while, even when they were open, kids not there. I know the college kids as well. You mentioned the incident in UConn where there's a big party. I know the frustration. It's like a tight coil. Everybody's ready to spring at this point, and I'm just trying to cool things down a little bit longer. We're going to have overwhelming vaccination over the next few months, and that's what we got to do is get a glide path to that point. I understand where people are, and we're getting there.
Thank you.
NBC Connecticut.
Good Monday, everyone. Colchester Schools was closed today because of a significant number of staff having side effects from the vaccine. Are you hearing this happening elsewhere? And should school districts, parents, students be prepared that this could happen? I'm not hearing that, but Josh, you want to take that?
No, it seems like an unusual case in Colchester. In fact, that clinic from Saturday, there were a total of 6 school districts that participated there. I think 700 educators were vaccinated. It seems like only Colchester had, a handful of people call out sick and enough to impact that elementary school. So we don't see anything unusual overall statewide, we have 11,000 J&J doses administered in the first few days they've been here. Haven't heard of any other reports. So people should expect some side effects, body aches, chills. That's normal. The Colchester case seems a little unusual, though.
Based on how vaccination is progressing, do you feel like the timeline for when the next groups would be eligible is still on track?
Yeah, very much so. We're making great progress. As the governor pointed out, a week into this next tier of 55 to 64, we've already got a quarter of the population they are vaccinated. So our providers are doing a fantastic job. We had over 35,000 vaccines administered last Friday. That was an all-time record for the state of Connecticut in one day. So we're really cranking right now.
And Senator Murphy, my last question goes to you. You say that this is going to hopefully be the last relief package from Congress. What makes you think that this will be enough, given that we are still not over this pandemic? There are still restrictions taking place at this time.
I just look at the pace of vaccinations, the remarkable decreases we've seen in positivity rates and hospitalizations, and I'm optimistic that combined with continued responsible behavior and fealty to CDC and state guidelines, that we can turn the corner and that we can get this country back on a path to full economic recovery. Obviously, you should probably never say never. And so I'm telling you today that it is not our plan to pass another rescue plan. But we will obviously be vigilant and sort of watch the trajectory of coronavirus and its variants. But, I do see the work that we're doing on vaccinations, the work that we've been doing on prevention as allowing us to put ourselves in a position to move on. And listen, there are, other issues that President Biden needs to deal with. We've got to pass an infrastructure bill. We've got to deal with climate. We've got a badly broken immigration system. So Congress has other work to do, and that's why we decided to go big and bold with this plan so that we can implement it. We can let the states put the money where it's needed, and that Congress can, have the room to be able to try to move to other issues that still, linger as crises and as priorities for the American people.
Thank you.
Fox 61.
Hi, Governor. We're still receiving emails from residents as recently as this morning who registered through VAMS and were told they would receive an email when they were eligible to sign up for a vaccine. They are now eligible, falling within the age requirements, but have not received that notification email from VAMS allowing them to schedule an appointment. Do you have advice for the people out there that are dealing with this type of issue?
VAMS can be a little clunky, but we've had 775,000 people through a variety of different mechanisms, including VAMS, be able to, make an appointment. As you know, we've, quintupled the number of people answering the phone for those folks who don't feel as comfortable doing it online. Josh, do you have anything to add to that?
Just a couple of things. One, check your junk folder. Sometimes the email ends up there. But aside from that, you can fill out a form again that might be able to re-trigger the invitation. But also a reminder, if you go to our website, ct.gov/COVID-vaccine, there are multiple other ways to sign up for a vaccine appointment through some of the other large hospital systems, through the pharmacies, or through our call center as well. So that is just one of the many ways that you can register for a vaccine appointment.
Thank you. And then considering this new CDC guidance and the goal to have a vaccine for essentially anybody who wants one by May, do you have a rough time frame for when maybe mask wearing and social distancing in Connecticut would become guidance, not a mandate?
Yeah, I mean, my preference would be once we get closer to herd immunity. But on April 20th, the legislature may have something to say about that. My strong recommendation is outdoors, use your discretion. Indoors, especially in a public place, continue to wear the mask.
Thank you.
And Governor, if I can just add, what's important about the president's announcement with respect to May is that, this is all dependent on the American Rescue Plan passing and being implemented. Again, the House still has to pass the Senate version. The president has to sign it. But in that legislation is $10 billion to increase the production of vaccines, and then a new fund to help pay for the implementation of the vaccination plan. Obviously, these vaccination clinics don't happen for free. They are expensive, and so we need this funding coming down to the states, municipalities, in order to pay for what will continue to be increased vaccination platforms run by the state and the state's partners. So in order to meet that sort of rough May target for availability, we need this piece of legislation passed and implemented.
News 12 Connecticut. WTIC 1080 News.
Hi, for Secretary McCaw, where does the federal rescue plan put the state budget for this year and next?
Great. Thank you for the question. First, you might recall in the governor's recommended budget that we were relying on approximately $1.75 billion in federal relief that would go towards revenue loss and replacement. The bill that passed the Senate that will go to the House does have approximately $2.6 billion in state relief. So therefore, there's significant resources in there depending on the final outcome of the budget and our work with the legislature to support the proposal and to ensure stability in our programs, as well as to allow for additional investments that the governor and the legislature feel are necessary. So we're in a good position relative to the work of Senator Murphy, our delegation, and the rest of our counterparts in Washington.
And for the senator, one of the things Mayor Bronin's going to talk about in his State of the City speech at 5 is expanding vaccinations into the city. There's been a lot of effort on getting vaccinations into the city, Black and brown communities. What does the rescue plan do for that? And if those communities still lag in getting the vaccine, what can be done?
Well, there's $8.5 billion in this package specifically for vaccination activities. And so, my work now, once this bill is signed into law, is to get that funding down to the governor's office and the Department of Public Health as quickly as possible so that it can be distributed out to the cities and to other clinics. What we're going to need to do, especially as time goes on, is massive outreach. Remember, in a system that is first come, first serve, the folks who, don't need to be convinced as to the importance of the vaccine are the ones that are going to be coming in the door initially. We're going to very soon get to the point where, the remaining folks in Connecticut who have not yet signed up may have some questions they want answered about the safety or the efficacy or the necessity of the vaccine. And so we're going to need outreach workers to do that. And again, that's not inexpensive. So the money that's going to the states and the local governments can be used for those efforts. But we also have this set aside of $8 billion for vaccinations and vaccination outreach that will be getting to the states very, very quickly.
The Associated Press. The Waterbury Republican American.
Thanks very much. Last week, there was a bulletin that the Department of Public Health sent out to vaccine providers that was warning that they shouldn't expect any Johnson & Johnson vaccines this week. Has that changed? What's the situation there?
No, that's correct. We did not receive any Johnson & Johnson vaccine in our state allocation this week, but we did receive a substantial amount of Moderna and Pfizer, and as the governor mentioned, another in total 137,000 doses coming into the state. So our vaccinators will stay quite busy.
Okay. And this figure that the governor mentioned, about 775,000 people registering, where did that come from?
Number of first doses administered.
Number of first doses administered. Okay, thank you very much. I'm not quite sure, Secretary McCaw. I was reading through your written testimony. I unfortunately had to cover another hearing today. What essentially was your message to the Appropriations Committee? This is going to, this funding issue is going to be taken care of in the budget, so we can negotiate it there. Or were you saying we can negotiate stuff in the budget, but if there's anything in the future, the executive branch would like to retain some discretion? Could you maybe fill me in on what your message was today?
Sure. So first of all, the governor and the administration fully respect the legislature as a co-equal branch of government and respect that we jointly want to make sure that stakeholders across Connecticut receive relief where allowable under the American Rescue Act. There are a couple of distinguishing factors. First and foremost, how we utilize these dollars will be governed by the bill language, which we have not received the final bill, and the guidance that will be forthcoming from the federal agencies. Secondly, our strategy for use of these funds is directly tied to the final determination of the state budget. How much will we need in order to take care of revenue replacement, final decisions on programs. Third, the bill as currently drafted does not really adhere to the current legislative process that we typically follow when we're appropriating funds for spending, one in which the governor would submit a plan, the legislature would propose their plan, and the governor would have the opportunity to weigh in. We think that's critically important, that some of these components get incorporated into the bill. At the end of the day, this is about ensuring that we have a balanced budget, one that provides stability to the programs across the state of Connecticut, and that we jointly make the investments that are important for the state of Connecticut. Those pieces need to fit together, and they need to be done in a way that complies with all the guidance that's coming from the federal government. The last thing that I think the governor's noted and CEO Josh Shabal's noted is that our success in Connecticut has been linked to our nimbleness of us being able to respond to the needs when they arise. And so we do believe that the governor will need to have some discretion to ensure that there's flexibility in how these dollars are used. So we will continue to work collaboratively with the legislature, but those are some of our initial positions on the bill as currently drafted.
Okay, thanks for filling me in. And just one last question for me. It might be to Josh or the governor or Paul. I don't know who would be in best position to answer it. But are you still waiting on guidance for nursing home visits from the CDC? I received a call from a reader this morning from Naugatuck. His wife of 47 years has been in a nursing home. He wants to see her and see her more often. When might folks in his position get some more guidance, either from the state or the federal government on, something like nursing home visitation? Thank you.
Want to take that, Josh?
Yeah, no, I don't think anyone should be waiting for guidance at this point. CMS has put out extensive guidance with regards to visitation in nursing homes, and where you have a case where there's no COVID cases in that home for a period of 2 weeks, which thankfully at this point is the vast majority of the nursing homes in Connecticut, visitation should be allowed. And so if people are having challenges with that, they could reach out to the long-term care ombudsman for assistance. But, we expect all of our nursing home operators in the state to be in compliance with CMS guidelines for visitation.
But last Thursday, you said you had been expecting some sort of guidance on post-vaccination directions. Anything on that?
Yeah. Okay. So this is an important point. The guidance that the CDC put out today with regards to activities that people who have been fully vaccinated can engage in is with regards to non-healthcare settings. So when it comes to nursing homes or hospitals, people need to keep their masks on, but it doesn't restrict visitation.
Thank you.
Hearst, Connecticut Media.
Good afternoon. So the state didn't receive any Johnson & Johnson vaccines this week, if that's correct. Is there any news on an increase to the vaccine supply coming to the state in the near term?
We've got a pretty good 3-week window. We're getting J&J again next week. The COVID task force was very clear that nobody across the country was going to get J&J last week, but now it's rolling back again on schedule. You'll continue to see a ramp up, which I think keeps all of our projected dates for other age groups on schedule.
Yeah, It's worth noting, too, especially with Senator Murphy on the line here, who was a fierce advocate early in the pandemic for using the Defense Production Act to scale up manufacturing of scarce resources, that the Biden administration has announced a partnership between J&J and Merck, who's going to, under the Defense Production Act, start manufacturing the J&J vaccine and really help scale that up. So I think we'll see more J&J vaccine in the coming weeks and months.
Yeah, that's a partnership that's made possible by the Defense Production Act. This is a capability that the Trump administration used sparingly to be as generous as possible to the Trump team. What the Defense Production Act is going to do in this case is give Merck preference with its suppliers, because in order to retrofit its facilities to make the J&J vaccine, they're going to need to very quickly be able to draw on parts and components from the pharmaceutical manufacturing supply chain. The DPA is going to sort of give them preference, frankly, allow for other contracts to be set aside so that Merck can get what it needs to be able to start producing J&J vaccine within the next couple months.
Thanks.
The Connecticut Mirror.
Good afternoon. The package that you're talking about is historic as far as how it addresses child poverty. But the child tax credit will expire in 2 years. Some of this other money will go away sooner than that. So to what extent does this package underline what is the obligation that the state of Connecticut and the federal government has to attacking child poverty on a longer term basis?
Well, let me just take that first. Listen, my hope is that Congress is going to choose to extend this increase in the child tax credit and make it permanent. I think we are going to see the immediate benefits of lifting half the kids who are currently living in this country in poverty out of poverty. I think you're going to see that in their educational achievements. You're going to see that when it comes to the benefit that accrues to their health, as their parents have easier access to primary care doctors and healthcare specialists. So while this bill only implements this increase in the child tax credit for a couple of years, my hope is that when Congress sees the benefits and hears the clamor from the American public to make it permanent, that will answer that call. So, yeah, there's no doubt that the state is going to have to spend this money in a way that is careful, right? Because much of this funding is not going to be renewed. But my hope is that the child tax credit will be made permanent after the country and the Congress sees how impactful it is.
When it comes to education deficits, I think most researchers believe that they cannot be made up in a year. And obviously there's a lot we will learn about what has been the impact of this past year on school-aged children. But again, given that specifically the stuff you worked on is going to be there for a year, what should the states expect as far as stepping up on a long-term basis to reach out to these children?
Well, the good news is that the education dollars can be spent over a number of school years. And so there are some cases in which the education dollars can be spent into the 2024 school year and beyond. So we recognize that you can't make up learning loss in a year. You can't deal with the emotional trauma of not being able to be with your peers or being at home in an unsafe environment in a year. So I think school systems are going to be able to take this money and allocate it out over a couple school years. That's good news. Again, we have to recognize that this plus up in front funding is not permanent. So I think schools have to think twice before they hire more classroom teachers. But they certainly, when going out and hiring additional social workers or special education paraprofessionals, will have the ability with this money to hire folks for more than one school year.
Governor, the state of Connecticut, the way it used the ARRA money in 2008, 2009 set up a huge deficit for the out years. So what are you doing to make sure that there is not another cliff that Connecticut's going to fall off of in 2 years?
Well, first of all, I think it was helpful that the American Rescue Plan is 2 and 3 years out. I mean, it would have been really hard on us if it went through the end of this calendar year and then there was a cliff. So this gives us an opportunity to plan accordingly. And like, Chris said, we might see things that work and things that are going to be able to continue forward, either with federal support or at the state level. Look, 2 or 3 years out, we're going to have a different economy, an opportunity economy, more growth. We'll be able to step up more. And I think the child tax credit is transformative. And any time that Chris Murphy and Mitt Romney agree on something, it probably has some long-term legs to it. So I'd like to think it's a permanent part of lifting our kids out of poverty.
And Governor, if I could just add to that, a couple other things that I point out. Number one, we had a $4 billion budget deficit, and the governor did not choose to close that entire gap by utilizing a rainy day fund or relying on federal stimulus. Where there are opportunities or initiatives to drive down spending, efficiency saving, or hold the line on increasing some of our programmatic costs, the governor did that intentionally to avoid the cliff effect. Secondly, all of this funding that's being poured into Connecticut's economy is all geared towards getting us back towards full employment and building our economy, which will help us to recover the lost revenues and to put us back on the trend of growth. So the governor was very strategic in putting together the budget that's before the legislature to control spending while at the same time really relying on stimulus to grow the economy. We're going to get back to a place of growth. We're seeing that in our revenue estimates. And for that reason, that will help us with some of the cliff effect that the governor is trying to avoid.
Thank you.
The Hartford Current.
Hey, everybody. This is Emily Brindley from The Current. First question, I think I heard you guys give an update on the number of cases of the B117 variant. Would you be able to go back over what numbers we have now?
Yeah, I said we were up to 81. Josh, anything you want to add to that?
No, that's correct. There'll be more details in the evening press release, but we're up to 81 of the B117, and then we have one additional case of the South African variant to report as well.
Okay, so that's quite a big increase in the number of cases of the B117 variant, isn't it? I think we were at 40 or something before. Are these all from the past week or so?
I think the last week and a half. As I think Dr. Fauci predicted a month or two ago, I think he predicted by the mid to late March, we would expect to see the B117 variant become the predominant strain in the United States. And I think we're on that path right now. We're meeting regularly with the team at the Yale School of Public Health. They're doing a lot of the sequencing and modeling around this, and they indicate that we are on that path in Connecticut as we are around most of the rest of the country.
Are there any concerns about that variant kind of picking up speed right as we're heading into the reopening?
I'm not as worried about that because I've seen the variant down in Florida, San Diego now close to 2 months. I've seen that the increase, it is increasing. It could be the dominant, but at least it's not increasing exponentially, as I said before. And if we did find things were changing, we have the ability to change course. But right now, I think the vaccine is staying ahead of the variant, and that's slowing its increase. And by the way, the vaccine works against the variant.
Thank you. And then an unrelated question. There was, I think somebody might have asked about this, but I would like to elaborate a little bit. Is there any concern, again, as we're reopening, about off-campus parties at colleges? There was quite a large party this weekend at UConn. Wondering your thoughts on whether those will increase and if you have any plans for further enforcement.
I tried my answer on that. Paul Mounds, do you want to try it? All right, if Paul's not there, I'll look. I worry. I see these things. I see them as potential super spreader events, and I know that these are folks who aren't vaccinated. I know that young people are the ones least likely to be at risk, but they can still infect others. So I've got to urge caution, especially for the invincible generation, a little bit longer. Paul, something you want to add?
Yeah, I'll add something, Governor. And the state police, led by Commissioner Ravella, and their team did a great job of making sure to crack down on it. They are the one thing Commissioner Ravella said that we do have individuals as part of our state police force that are in these areas making sure these parties are not happening. So they're going to continue the overall enforcement for the overall public safety for the people here in Connecticut. But as the governor said, we're going to keep that in mind as it deals with us going forward. And we are concerned about that. And we're going to continue to talk to our college communities about the importance of not having large gatherings, especially as we get further in the process, and also the fact that they're not fully vaccinated at this time.
And one last question, Governor. Somebody else asked you earlier about the timeline and whether we're still going to meet those goals. Is there any chance that we might be ahead of those goals, especially with the president's announcement that manufacturing is obviously increasing quite significantly?
Yeah, I'm not going to predict that yet, but let's face it, they're ramping up significantly. As Chris mentioned, with the Defense Procurement Act, we're going to have a lot more J&J slated. They've obviously doubled the order of both Moderna and Pfizer. So I think we're on schedule, and we could be ahead of schedule. And again, one last thing, back to those Yukon parties. When the Yukon women win the Big East tonight, hold down the partying.
All right, thank you all. Appreciate it.
Connecticut Public Media.
Good afternoon. This might be a question for Josh. I noticed today's numbers from the CDC that Connecticut is now behind the national number when it comes to the percent of the population that's fully vaccinated. What accounts for this, and are we having trouble getting people back for shot number 2?
No, there's a known issue with the CDC's reporting where they're misclassifying some of our second doses as first doses. So there's about 64,000 doses that they have misclassified in their reporting. So we've been meeting with them for a week to try to help them figure out how to correct that in their data. The data that we provide is, I think, the one that's more reliable, although it's worth noting that we don't have in our data some vaccinations that are done in Connecticut by our federal partners, in particular the federal VA, who's been very active. So we don't get visibility to that. But the ratio of first and second doses that the governor reported earlier is the more reliable one until the CDC can fix the data flow on that.
Okay, thank you. And we've spoken with professors at Yale, an epidemiologist and infectious disease doctor, and both were very hesitant about the state reopening on March 19th and the way it is, since we don't know the impact of the strains, and now we're starting to see more in Connecticut. Can you name the doctors or organizations who were kind of the guiding force behind the decision that March 19th there could be 100% capacity again?
Why don't you take it this time, Josh?
Well, look, I think as the governor's spoken about many times, he takes advice, counsel from a wide variety of people, including public health experts. But, as we've looked at the metrics and the trends over the last month to month and a half, consistently going in a very positive direction, the kind of unmistakable positive impact that our vaccination program is having on reducing severe illness and hospitalizations and deaths. With a lot of that input factored in, he made that decision. And as he said, those actions are still a week and a half away. We'll continue to watch the metrics very carefully. And if we need to change direction, that's always his option.
And is that the same date that state courthouses will be open to a bigger capacity as well?
Do you know that, Paul?
No, I don't know that offhand. We'll be happy to check back in with judicial, separate branch of government who's making those decisions as it deals with their courthouses.
Okay, and last question, and correct me if I'm wrong, Governor Lamont, did you say you are going to a UConn game this week?
Not to the game this evening. Tempting as it is, I'll be watching the men carefully down at Madison Square Garden. That's a real possibility.
And you feel safe doing that?
I do feel safe doing that. I've had my first vaccine going back now 2.5 weeks. I'll have my second vaccine very shortly.
All right, thank you.
And I wear a mask.
CT News Junkie.
Thanks, Max. Governor, some folks, some attorneys at the Greater Legal Aid, Hartford Greater Legal Aid and New Haven Legal Assistance have filed a complaint with the U.S. Department of Health and Human Services Civil Rights Office, basically alleging that your sort of age-based vaccine rollout discriminates against non-white folks and folks with pre-existing conditions. I wonder if you might respond to that complaint.
As we've said before, I think rather than all gaming you see going on in other states as they play games in and around their vaccine rollout, which is much more complicated, ours is based upon public health. And our rollout is simple, but it's also based upon public health. And it says that those who are most likely to be infected, most likely to suffer complications, most likely to die are going to be the ones that get vaccinated first. And that's based on age. And then we've doubled down with a separate allocation, especially for the most underserved communities, and particularly the African-American community, where we have to do a special outreach to make sure that they get vaccinated. And I think we're having some success there. We still have a way to go.
What do you make it just in general, that claim that the age-based metric sort of discriminates against those folks?
I think it's false.
You think it's false? Okay. Josh, you mentioned earlier that there was a website people could go to, these child care providers who are not connected to schools or districts. We've heard some complaints for those folks. Do you have numbers on like how big that population is and how many of them have been vaccinated?
No, we're not tracking that. But if anyone's having challenges, child care providers who are having challenges getting access, they should definitely reach out to the Office of Early Childhood, and they can help make sure they're getting connected to vaccine clinics.
Okay. Thanks, everybody.
The Day of New London.
Hello. If I could go back to a question about supply again. I know we've touched on this a couple of times already, but with both of the casinos in southeastern Connecticut are online now with mass vaccination sites, and at both of them they tell us that they could be doing a lot more vaccines than they are, and they're just limited by the supply. So just again, how confident are you that when will these places have enough vaccine to give as many doses as the infrastructure is there to provide?
I'm as confident as the supply chain is. We're in regular contact with the White House and the COVID task force. You're right. Foxwoods, Mohegan Sun, and all of our vaccination centers could handle 2, 3, 4, 5 times the supply. And right now, there's still demand for that. So, Chris Murphy, anything you do down in Washington, D.C. to speed up supply, we'd sure appreciate it.
Yeah, I mean, this is an issue of manufacturing backup. The President Trump left us with an absolute mess. He could have ordered more vaccine from Pfizer and Moderna. He forsook that possibility. He did not use the Defense Production Act to put us in a position where we could very quickly ramp up those initial vaccine products. So President Biden is playing catch-up, but he's playing catch-up extraordinarily quickly. We have seen every week an increase in vaccine allocations. No, it doesn't meet demand, but very quickly, once that second order of vaccine comes online, and once the increased production due to this agreement with Merck begins for the J&J vaccine, we're going to move from a position of scarcity to a position of abundance. It's not going to come fast enough. But this vaccine money in the American Rescue Plan, the $8 billion, is going to help us increase the capacity to distribute that vaccine once those second order and additional J&J vaccine come online. But President Biden was sort of put in a very unenviable position with not enough vaccine having been ordered. He's making up for lost time.
So do you have any idea when will be this quantum leap in supply that you're referring to?
Well, I mean, it's going to be in the springtime. I mean, the reason that the president has predicted that there will be enough vaccine for any adult who wants it by May is that around April, that second order of the initial 2-shot vaccines, as well as the additional J&J vaccine, will begin to become much more widely available.
Thank you.
I guess that's it. Hey, first of all, Chris Murphy, thank you for working double overtime on behalf of the families and kids here in the state of Connecticut. Great appreciation to you and the entire delegation. Let me just say very quickly, you see this from 1 year ago. It was 1 year ago that we had our first test positive. And what a hell of a year it's been. And we've learned a lot. You know, you see in that picture, look at those numbskulls. None of them are wearing a mask. They're not social distancing. But we've learned a lot in the last year, and it's making a difference. And I think it's making a difference you see every day in terms of how we're progressing in terms of vaccinations, how we're progressing. As long as you maintain the diligence and wear the mask a little bit longer, we're going to get there. So look, to our team, thank you. Chris, thanks again. Take care, everybody.